Hello and welcome to Slice of Piefer. I'm Dr. Piefer. I am here with Taylar. She is super pumped to be here. She's dreaming of AI taking her job. Hello, Taylar. Welcome.
Hi, Dr. Piefer.
Do you feel like AI is going to take this portion of your job specifically?
It would probably do it better than I do. Less sass.
No chance. No chance at all.
You say that now.
We could build in the sass.
You could program the sass into the bots.
Yes.
Perfect.
I need sassier.
More eye rolls.
more insults, please.
Yes, feed me your booze.
It would be good. It would be good. How was your Easter?
Good. Very good.
Awesome. We had a very nice Easter as well. It's a little bit different with teenagers. They just keep getting older and older. They do like good candy, though. So that's good.
The taste is getting more refined.
Correct. The Easter Bunny comes up with, Cadbury eggs and other things that are pretty good,
Pretty good.
Taylar doesn't even eat Cadbury eggs.
I don't actually. It's not that those don't speak to me. Now, like the Reese's peanut butter eggs or bunnies and stuff, those talk to me.
Right.
But it's so crazy. I don't even eat those anymore.
You don't even eat them. You just work out and cry.
I don't cry. The working out helps me to not cry.
I hear you.
Gives me that dopamine hit.
I like it.
But not like cardio days, though. Those days I do just cry.
Right. I'm with you. All good. Yeah, we had a really nice Easter. Chrissy and Caleb visited Arkansas, the school.
Oh, Sui?
Yep.
Oh, great.
They have a really, really great track program, apparently. They have one of the top 3 Greek programs in the country, which neither Chrissy nor I were in fraternity or sorority, but that was interesting. Caleb said that a bunch of the boys on their tour were trying to get a tour of the fraternity houses. The funniest of which being a person who was sitting on the roof sunbathing and studying, who then they said, "Will you give us a tour?" He said, "No, come back for rush." They said, "No, really, will you give us a tour?" And he said, "Sure, come on in." And they said, "Really?" And he said, "No." Like, that's good. I like that kid already, whoever he is.
Living the dream.
He's just living the dream.
Sunbathing
hanging out on the roof.
Studying, probably with an ice cold Coors Light in hand.
They didn't say that. It was also morning time.
Well, fraternity might be more like Natty Ice or Natural Light or something like that.
Could have been Kool-Aid.
Sure.
Or maybe a Diet Coke.
Yeah, of course.
He had fresh squeezed lemonade.
Yeah, hand squeeze with some vodka.
Taylar, you just keep taking us.
Just being myself.
Real.
You asked for me to be here, so you get what you get, and you don't throw a fit.
You get what you get, and you don't throw a fit. That is true. Very true. We had. Let's see what else has been going on. Anything else good for you guys? Gymnastics is rocking, right?
Yep, rocking and rolling.
I heard maybe some interest in softball potentially for one of the monkeys.
One of the monkeys is interested. We'll
Nice.
see. She's interested in everything for about 30 seconds, so we'll see.
That's good. That's all right.
Yeah.
A little indecisive.
She gets to explore. She's figuring out what she likes, and that's fine. At this age, she doesn't have to have it all figured out.
Right. Maybe she does like Cadbury eggs. Maybe she likes Reese's peanut butter eggs.
She really liked her grandma's banana pudding. That's
Nice.
what she really liked.
Nice.
Yep, she was super into that. She's like, why can't I have this every day?
Right. That sounds like she's a cut of the same cloth. Interesting. Yeah. That's very cool. Yeah. All is well. Clinic has been blazing.
That's a word.
I mean, we've had a lot of people here.
We have.
That's been good.
Yep.
Keeping us running.
Yep.
And
Good thing.
we were talking a little bit. Some people put some nice stuff online. That was really cool. Although what somebody was asking me, are you allowed to respond to those?
Yeah.
And I think technically it is a little bit of a sticky territory.
It is.
Right?
My personal favorite that I have to read out loud on this podcast.
Oh, we're going to go
It's
with
posted anonymously, so I feel fine about it.
We're going through the alcohol statements as well, correct?
Going bald and has a big head, but he has a nice smile. Looks like someone I would have a beer with. That's my favorite.
Top.
comment.
You're in the top comments of Taylor's favorites.
There were so many good comments, and that one just stood out to me.
Right, anonymous.
Chef's kiss. 10 out of 10. No notes.
10 out of 10. Well done. Yeah, I mean, I appreciate that. I do wear a pretty large hat. I am definitely. I mean, going bald is very kind.
The funny thing is that picture is from how long ago?
Yeah, that's from a long time, from the beginning of when I started.
Yeah.
12, 13, 15.
It was like a super old picture they posted. It was like going bald. It's like, I think you're going to use the phrase went.
Listen, this is not an English class. We don't need past participles.
But you do have a nice smile, and you are a good person to go have a beer with.
Also, I appreciate both of those things. Very nice.
Mm-hmm. I don't know that those are things like if I'm looking for a surgeon that is really going to stand out.
This guy seems like he would smile at me and drink a beer.
I mean, and again, this guy, the comment or the post is about like, do you recommend this surgeon? And this guy's just like, you know what? I'm just going to throw it out there. Looks like he's got a nice smile. He's got a big head and is going bald, but he looks like I could have a beer with him. I appreciate that.
Seems like.
Like, I don't know him. I don't know anything about his surgical prowess, but here's my thoughts.
Right.
And I'm going to post them anonymously.
The AI for this is just going to be my bald head on a bobblehead mug of beer.
Oh, my goodness. It's going to be
glorious.
Great.
Glorious.
Yeah, I love it.
Well, I mean, I appreciate that, Taylor. Mm-hmm. I was surprised. I did get quite a few updates about it from a lot of people. Like, people sent it to me like, hey, what's going on here?
Yeah.
But it was unprompted. I don't know what happened. And then, the other question was, can you respond to those? And so I think more than saying like, thank you, or that's great, or I'm glad you had a great experience, like really truly acknowledging that someone was your patient and that you did surgery technically could become a violation of their own patient protected information. So you have to be cautious, especially if people say nice things or if they say not nice things, because ultimately, even if you acknowledge either one, you don't really know, is that the person they say they are on the other side? And so it makes it a sticky situation, but it can also make it kind of hard for patients, right? Like, hey, did you get my comment? Or, hey, did you see that I thought you were the best?
Sure. Blah, blah, and it's hard for patients for both ways, though, because you can't, because we're not allowed to address any of that stuff, or we shouldn't, right? That's always, I mean, when I was in PA school, the malpractice stuff was always just don't respond. You can't say anything. There's no good that comes of it.
Right.
So like as a rule, I when anything medical like that, I'm not going to respond to. I'm always happy to see like when people say nice things, but I'm just not going to do it from a legal standpoint and to protect those patients' rights. But like you said, what if it's somebody you never even operated on, but they're saying all this stuff because there's a doctor whose name sounds like yours, or they think it was you, or they don't remember, but you look like the person. And so they just make a comment that maybe is not anything you ever did, or were even a part of their care team, but how do you address that?
Right.
Yeah.
I think that's an interesting question, because if you were never part of their care team, then technically you may not be violating any information.
Correct.
So
that's the sticky part.
But if you said, I was never part of your care team, but you really were, then that's a challenge too. So I think if you can confirm that you weren't part of their care team, then it's probably easier to walk back that piece. Now, if they were a patient who was upset about their outcome, or they were not, 100% satisfied, and you acknowledged it, then you they outed themselves, but you also confirmed that outing. And specifically, you don't know, right? Could it have been their mom or their husband or their sister or their brother who used their account and wrote it, and now you've confirmed it, and now you've walked your way into a HIPAA violation, and medical violations are a big deal, right? I mean, that can cost you being reported to the Texas Medical Board. It can cost you your license. It can cost a lot of different things, and so you want to be cautious with that for sure. But I do think, I'm kind of thinking out loud, if you really didn't do the surgery, then probably just saying, hey, you got the wrong guy or gal is probably not a violation of anything.
Right.
Right?
It's interesting.
Yeah.
Interesting thoughts. Because,
Yeah.
like, there's some things where it's like, he did this procedure on me. I'm like, I could say with 100% certainty he doesn't do that procedure.
Right.
Right. So you're probably thinking of somebody else who either has a similar name,
Right.
or.
He sewed my foot on backwards.
Right. I haven't done rotational osteotomy since residency.
Right. Meh.
Oh, man. You know what that made me think of?
Yes. Your favorite movie?
The fact that you knew.
Yes. That's a terrible, terrible movie, and it is the worst. I don't want to talk about it. It makes me feel uncomfortable.
Oh, my gosh. Poor Dr. P.
It's the worst.
I didn't think it was the worst.
I don't like movies where I think that I could do what they're talking about. Not that I would do it, but like you could do that.
I know, but I'm thinking of things like
rotate people's legs the wrong direction.
you watch like sports movies, like this. I like this because I can never do that.
No. Maybe, yeah. Maybe we're not speaking the right language.
Are men from Mars and women from Venus?
Yes, that is correct. Very much so. All right. Well, what are we getting to today? We have some fun stuff, right? We got to talk about the leadership diagnostic because we are going to launch a website about that.
By
leadership,
we, you mean you? And I'm
and
just
by we, I
here
mean
for
it's going
emotional
to be
support.
Taylor's website. She's going to be the one who answers all the questions, does all the stuff.
Can you put a disclaimer on this website that says I have nothing to do with it?
Yeah, it's going to be a picture of you dressed like Pocahontas.
No. No.
Dang it. We're going to try.
It's going to be a disclaimer at the bottom. Taylor does not endorse this product.
That's rude. So rude.
Taylor didn't develop this.
Anyway,
Taylor's just subjected to it.
So we've talked about the leadership diagnostic in the past. We've talked about what those different types, and we've talked about why I feel like it's important for leaders not only to recognize their strengths, but also to really identify their weaknesses and then try to get better.
Sure.
And when pressure gets high, that's when people, I think, struggle the most, right? Whatever your leadership pathology it is where that comes out. When the stakes get the highest and the pressure gets the highest, that's when you're going to tend to fall into that area. That tends to be also not the best and not the most healthy, right? Either for you, for your clients, for your patients, or for your team.
Right.
And so that part is what we want to talk about. But interestingly enough, right, people are leaders and leading teams not because they're just totally terrible at what they do, right? They also are very good at what they do. But when you look at the leadership diagnostic kind of is focused on weaknesses. So what I wanted to do was talk a little bit about strengths.
Okay.
Right? So I'll ask you first. But so the first one, right, is the tyrant, right?
Of course he is, because the tyrant has to be first.
He's got to be first. But right, so when the pressure goes up, these people tend to be highly productive. They tend to be respected for production, but they tend to treat their team members kind of like tools. They're focused on focused a lot on themselves, as opposed to potentially focusing on their clients and their patients. But what are the good things that you see out of these folks? What would you say? What would you expect if somebody has a tendency in their highest pressure moments to do that? How do you think they'd behave normally, or what are their positive attributes?
I would say when I think about specifically the tyrant, the thing that comes to mind to me that's positive is a lot of times they do tend to be like they're boundary pushers, right? They're boundary testers. They're testing that line to see where they can get, because it makes them either, again, makes them feel better about themselves or makes them more efficient and better at what they do, so that they can boost themselves up. And so I mean, I think of them as innovators sometimes, right? Because while sometimes, yes, pushing the boundaries results in and like personal boundaries being crossed, right? When you start putting your emotions and your everything on the tools you're using, the people, and there, you guys don't want me to get home to my family. You guys don't want this. You're not working hard enough. But when they use that boundary pushing to push the limits of something that may be arbitrary, right? Needs to be something that's innovated or boundary that's to be pushed, right? I bet the first flip room came from a tyrant, right? I bet that wasn't a thing. Why would you ever give a surgeon 2 rooms? Right?
Because one's going to sit empty for a little bit, right?
Somebody had the confidence and to say, I can get more work done quickly, and I'll make these rooms more efficient if you save both of them for me, give me 2 teams, and let me keep going.
Right.
And thus the desire for that was born by all, people who are driven and want, to get more done in the same 8 hours as everybody else. So I do tend to think of them as kind of like your boundary testers and seeing like, is this boundary here for a good reason, right? Is there a reason that we do things this way, or can I push this and come up with a new way to look at something that may make the industry better, that may make ultimately better for the patients, right? If a patient's not having to wait 8 weeks to have their surgery because they can do more cases and the same amount of time, then that's great as long as they're doing it well. Saying that all other things are considered the same. So that's one big thing I think of.
And that was what I thought is if your tendency is to be that sort of high level, high productive, high push, but potentially not respecting your team, you have to be skilled, right? You've got to be good at what you do, because if you're not good at what you do, then no one will make the excuses for you, right? Like these tend to be the people who the team would be like, man, he or she is a real bear to work with, but I wouldn't want anybody else to touch me, right? Right? Or, their bedside manner is like a, kimono dragon, but the outcome is going to be great. If you're not skilled and you're a jerk, then nobody's going to work with you.
Right. Those get fished out eventually.
Right. Those people get fished out quickly. And so you've got to have the skill, and you've got to have some of that drive to change things. And so I do think that when you look at those folks, there's people who are highly skilled, they're pushing boundaries, they're trying to increase efficiency. But when the pressure mounts, when you focus so highly on that and so highly on advancing yourself, when that pressure mounts, it can be easy to turn that against the exact people who are trying to help you, the exact people who are trying to get you there. And that's where the humility has to come back, right? You've got to be grateful. You've got to have gratitude with sincerity, and you've got to be humble and realize, like, wait a second, I can't do 15 surgeries in one day if I don't have this whole team getting everything ready for me. Right?
Yeah. Another phrase that I would say is positive for them would be you could say they're charismatic. A lot of them are very charismatic. And I mean, that's like in our industry, that's how you get patients, right? They trust you, you build a rapport with them. And so patients, I mean, for all intents and purposes, they do tend to like these doctors, these surgeons. And I would see that in industry as well, that they tend to be very well, like influential and very like have a lot of charm. Would be the word I would use.
And in those moments, absolutely. But in the moment when the pressure mounts, they kind of lose a lot of it.
Right.
And
which if you're the patient on their table and you're asleep,
you never see it.
Do you care if they're a jerk to everybody that's working with them, as long as your surgery went really well?
Right. And I would argue, yes, you do.
You should.
You should, because ultimately when you establish an environment that's based on pain, right, which tends to be fear and pain is the environment that gets established by the tyrant. Eventually what happens is people will stop speaking up. Patient safety will be sacrificed. People will do only the absolute bare minimum that they have to do to prevent pain. And what will happen is your outcomes ultimately will become worse and worse and worse.
Yeah,
right?
It makes me think of almost like uncontrolled hypertension, right? Like it works effectively for a while until it doesn't, until you have an aneurysm that ruptures or the cardiac muscle gets too thick and then they get heart failure. Or what, you know what I mean? And the pressure mounts up so high and you don't get it controlled. And then what happens? Eventually there's end organ system damage, right?
Right.
And so, like, again, if you're the patient on the table, like, well, as long as my surgery went really well and they're nice to me, why would I care? This is why.
And this is why. This is because that unsterile instrument on the back table that never gets mentioned because people don't want to get yelled at.
Or your sister who's the circulating nurse in that room who stays in this job because she needs to and wants to take care of the patients, but it comes home stressed out every day and
takes it out on her family or
takes it out on herself. That's the big thing, right? A lot of us, I mean, myself included in this, like when we have workplace stress or whatever, what do? We internalize that, and it comes in sacrifices that you make to your own like health and well-being. So because you're not you're not worth it.
I agree. So the next one is what?
The pleaser.
The pleaser. Right? This hits pretty close to home.
Maybe.
So what do you think? So the pleaser, right? The pleaser tends to be a conflict avoidant person, right? So they tend to also be quite well liked amongst
Popular.
amongst not only their patients and clients, but also amongst their teammates, because they don't have a lot of problems that happen.
Right.
But they ultimately will sacrifice improvements in the moment and a bit of pain in the moment to say, hey, here's how we could have done better, or hey, I really felt like this was our area where we struggled, to just say nothing, right? And then the really high level folks say like, I know we could have done better. Everybody saw we could have done better. Why, as our leader, are you not calling that out and helping us to move forward? And those high level people who want to be in high level environments will ultimately leave because they don't want to be a part of a group that tolerates mediocrity, right? And that is what it looks like from the outside.
Yeah.
From the inside, for the pleaser, it feels like I'm avoiding pain, like I'm not making people feel bad, I'm being the nice guy. But from the outside, what it looks like is you're kind of a coward, right? And that, and you're not willing to call out what we could have done better so that we can be better as a team. That is the negative side. What's the positive side?
They tend to be very compassionate.
Right.
You know, pleasers tend to be compassionate, empathetic. They tend to be a safe space, not only for, in our industry, their patients, but also for their coworkers, right? I mean, I wouldn't know anything about working for a pleaser, but one of the inefficiencies that sometimes happens is there's so many distractions that could happen because people would want to talk, you know, about what was going on or something. And again, as the pleaser, well, that's the way, it is. We just got to learn to work around it, or, that kind of thing. It's like, yeah, but we could be doing more. We could be making more. We could be seeing more. Well, we just they're only, going to let us, do this. So we just have to do this. But they tend to be, and the reason that people open up to them and talk to them is because they are compassionate, they are empathetic, but they're just, because they're out to please everybody, including, the people above and below them, they can't draw that line in the sand and can't push.
Right. And I think there's a balance that those folks have to recognize. You have to say, like, sure, you're a compassionate person. Absolutely, you're passionate about what you do, but you're also passionate about the environment that you do it in, right? I'm passionate about making sure that my team knows that they're well-liked and well-respected and that we're glad things happened. But when you take that too far, then it challenges the team. And the hard part about that is that in the moment when you're trying to make that decision, like, hey, we could have done this case better, but I'm not going to say anything.
Right.
I'm not going to say anything. Ultimately, your team members will go find somebody else who's going to push so that they can do the best they can. The high level folks.
Well, and like the pleaser, again, when I think about them, a positive thing is they're very self-driven. Right. They're adaptable in that way. I mean, how many times did somebody hand you the wrong instrument and rather than like handing it back and asking for a different one, would you just make that one work?
Right.
It happens, right?
I do that. Yep.
Yeah. I mean, you don't do it as much anymore, but you definitely used to. And like he hasn't used this tool in forever, yet they've handed him a zebra tractor, and here we go. We're just going to make this work, apparently, even though this isn't what we wanted. We wanted a Homan.
Right.
And then we struggle a little bit longer with that case, or whatever. And this is hearkening back to a long time ago and going, why didn't we just ask for what we wanted, hand it back and say, hey, I need this. But again, that means if those Homans end up on the floor, you're going to make that case go, and every other Homan in the building's been burned, and you can't use it. You make anything work. So
you can be adaptable.
That's an asset in some things, but it can become pathologic.
I agree. I agree with that. I mean, I think you're right. The person who's a pleaser can work with a lot of different things without complaining, without having an issue.
They make it work. They don't fall to pieces when something doesn't go exactly their way.
Right. No question. Yeah, I think that's a good summary for that. But the hard part of that is the person who lives in that world of being a pleaser, oftentimes they don't see, like, it's not so much that they don't realize those pieces, the positives. They don't realize, like, what am I losing?
Yeah, what's the negative that's coming?
What is, by me not addressing the problems that need to be addressed in the moment, tearing off the Band-Aid, so to speak, and realizing that this wasn't so painful. Everybody appreciates constructive criticism in a way that's constructive to make the team better, right? That's way different than being like, I hate you. You're an idiot. Right. Right. That doesn't.
Only an idiot would think I wanted this.
Right. Right.
Do you not want me to see my family tonight?
Right.
Wasting my time for 20 seconds having to hand off this instrument and get another one? Okay, I'm back to the Tyrant.
Right. Taylar has jumped into the Tyrant. But yes, so I agree. But I think that there are those pieces there. And I think part of the reason I wanted to do this today was also to just talk a little bit about, like, if you're taking this test because you want to be a better leader and you take the test and it says, hey, I'm a pleaser, right? That doesn't mean that you're an incompetent leader. It just means that under pressure, if you make those decisions, there's a few things that you can do, right? And for a pleaser, it can feel very courageous. Now, I'm using the word courage in a way that most people, right? There are a lot of people who are very courageous, right? Flying fighter planes, saving people's lives, doing all kinds of, like, telling someone we could have done this better doesn't take a lot of courage, right? But for the pleaser, it can feel like it, right? It can feel like, hey, this is a very uncomfortable situation. I'm going to avoid the discomfort. And they oftentimes will convince themselves that they're avoiding causing pain for the other person. When the reality is that done the right way, it's not really that very painful at all, right?
Well, and honestly, again, like saying, taking back to my example of the scrub tech who hands you the Z retractor instead of the helmet or whatever. You know how I would feel if I was that tech and I handed you the wrong instrument and then realized that you struggled a little bit more in that case when you could have simply said, can I have a helmet instead?
Right.
Like for me, that of 30 minutes of fighting soft tissue and stuff in a way that we don't,
right, that we don't usually do it.
Usually do it. Like, why wouldn't you just ask? Like, be the leader and say, I typically don't use these. I use a helmet, or actually, I prefer to use the pituitary ronger instead of
a coker or something.
Yeah, exactly. So to me, it's actually more painful.
Right.
And that's, as somebody who's a bit of a pleaser myself, that's something I've learned the hard way many times, is especially, when people who are close to me go, why didn't you just say something?
Right.
Why didn't you, instead of just taking it all on your own, just say that?
Right.
Like,
to get it
because
fixed.
I didn't want to upset anybody.
Right.
Then now you've upset them. So
right. Now your plan, your internal plan to save that pain in the moment has backfired completely.
Correct.
Right. Because now it's causing longer term pain that's not as fun. So very good. So the indecisive, right? The analytic paralytic. That's our next one. So these are the folks who tend to use data gathering in those high pressure situations. They use data gathering to delay making a final decision, right? And so when we don't necessarily need all the data to know that somebody needs X, Y, or Z, somebody needs blood products. Well, let's check another hemoglobin, right?
Yeah.
Or somebody needs something else, right? We need to get a follow-up CT scan or something along those lines, right? And before we decide that we got to go do open up their belly or something like that, which obviously we don't do that in orthopedics, but
if that's happening, something's going to be very wrong.
This is a major problem, people. What is he talking about? Right.
There's some small bowel.
Where's the bone in here? There's no bone here. This is crazy. But I think for those people, right, that can be really frustrating for the team. It can be really frustrating for everyone around you because everyone's looking like, hey, we all see what we need to do. Why do we keep getting more tests, right? Why do we keep, like in business, why do we keep analyzing the market? The market is clearly trending this way. Do we need another dot trending down for us to figure out that we need to do something and we need to act, right? And so I think that that indecisiveness or that analytic paralytic type person struggles in those moments, but it's kind of a fear of failure. It's propagating failure, right? So what's good about them?
I would say, if I'm thinking about the indecisive person, one thing I'll say that's positive, even though they're gathering a bunch of data and kind of paralyzed by waiting for that, they are curious, right? They're inquisitive, and that can be a big asset at times, especially in a leader, because you want some degree of that. You don't want everybody just shooting from the hip, like it's the Wild West every time. Sometimes you do need that extra information to make a good decision that's best for your patient. It's learning when's enough is enough, right? But being inquisitive and being curious is a really great thing. And then also practicing evidence-based medicine, at least in our field, right? That's something they tend to do really well, right?
Correct.
They're going off best practice most of the time. They're not going off old data. They're not doing it the way they've done it since 1984.
Right, right.
You know, they tend to be people who are constantly like learning. And
Sure.
I mean, that amount of, you know, knowledge base can be a really big benefit. Sometimes those are really good people to have, maybe not. Like sometimes as a leader, you know, that person being the leader can sometimes be a challenge. That person being on your team can be a strong thing, right?
Right.
But if I'm the leader and I'm an indecisive person, finding a way to balance that curiosity and that inquisitiveness and that data gathering with the ability to know when to pull the trigger, right?
Right.
When's the time?
Right.
But I think being, you know, curious is a good thing.
Right. And I think they tend to be curious. They tend to be data driven. No question about that. They tend to be people who are absolutely studious, absolutely, and they are also humility tends to be something that they're good at, right? Mm-hmm. Like saying, you know, it's hard for the tyrant to say I don't have the answer. Mm-hmm. It's easy for the indecisive to say, yeah, let me get some more data because maybe I'm not right about this, mm-hmm. right? Even though they know that they're right about it, mm-hmm. and everyone else knows they're right about it, so there's a value in that humility. There's a danger if it goes too far, mm-hmm. right? And so being humble and knowing that there could be more of an answer, or there could be more there, is not necessarily a bad thing. Mm-hmm. But if it's delaying your ability to treat and take care of whatever problem you're taking care of, I think that's an interesting way to look at it. Because you know, this is one of those where you think like, well, I mean, even the tyrant, like, how can that be positive? Right? How can it be positive to be indecisive? But you're absolutely right. Being mm-hmm. detail oriented, practicing evidence based practices, having some humility to say maybe I'm not right. That can be something that could save somebody's life too, mm-hmm. right? Save somebody.
Well, having that as your undercurrent isn't a bad thing, right? Having that is that your natural state of how you are, is that you're curious and that you are data driven. That's a good thing. It's just learning. It's learning how to balance that, right? Not letting the pendulum, you know, weigh down on that side so much that it causes you to not make decisions. Right. That it causes you to, let's just watch him one more day. You know, let's see what happens tomorrow. You know, when that's not the, you know, going to be the best for your patients, or depending on what area of business you're in. Like, you know, we got to learn to okay, now's the time. You know, you don't want to be behind everybody else.
Fever, white blood cell counts elevated.
Yeah,
all their infectious markers are up.
Mm-hmm. Looks like a duck. It's quacking like a duck. Let's call it a duck. We don't need the MRI to tell it's a duck.
Looks like there's an infection in the leg. Mm-hmm. Feels like there's an infection in the leg. Well, let's wait till we get a CT scan with IV contrast so that we can really figure this out. And then we'll give them another half day to see what's happening. And then all of a sudden you realize, like, we waited 12 hours and now now the patient is septic and they're getting sick, right? Mm-hmm. And so you've got to pull the trigger.
Now we're back to that end stage organ damage again too.
Right.
Sepsis. Right. So many medical references today. Ooh.
I know this is heavy medical, but also heavy leadership too, because I think the indecisive can happen as well.
Yeah.
Next up is another tough one a little bit for me, the flustered, right?
Oh, we're going to flustered.
That I skipped over? Well, we'll pick flustered anyway.
I like flustered. We can do that one.
Right. So these are the folks who lose control in the operating room or in that high pressure situation. Whatever plan they had is not going the way they wanted it to, and so they tend to kind of explode. And when they need people to move in, like there's a lot of blood in the field, there's a lot of problems happening. My plan A didn't work. They need the team to move closer, but because they sort of have an emotional outburst, the team protects themselves and backs away, right? And so that when you get flustered and you can't articulate what you need to articulate and you can't do it well without appearing to be losing control, that puts you in that flustered scenario. Not an easy one for people to be self-reflective about, but it certainly happens. And I think folks who know that they lose their cool will see that. Right?
And I think out of the different leadership types, like where we have these pitfalls, when I think about the flustered, you know, underlying that is some passion, right? They tend to be passionate people, which is good. And the reason they're getting flustered is because they care, right? If they didn't care, then they wouldn't get flustered and worked up like that. And I feel like at least there's some good tips and on how to manage that can change your whole perspective, right?
Right.
If you're somebody who gets flustered, learning that okay, I've got to have somatic control here. I've got to take some deep breaths. I've got to back up. I got to look at my hands, right? Doing all these things to learn okay, I've learned from previous experience now. This is what I do. This doesn't help the situation. Everyone, goes away from me, identifying that that's what's happening and going, okay, how can I resolve this? I know taking the next 15 seconds to take a couple of deep breaths and realizing that my being flustered is exacerbating the situation, and I care deeply about what we're doing here right now, and I can't let that be sacrificed. I think that I think that they have a really big opportunity to have a turning point with that, right? And it's a lot more visible with them than maybe some of the other leadership personality types. That's something that your team is going to notice early on if you can get that identified and treated. Right? Like if you can get that under control. I can think of a couple of people who early on in their career seemed to be very flustered types. But when they, again, they saw their outcomes were affected by it, more time under anesthesia or, again, having your crew kind of just back away from you and you having to do everything on your own. I think learning that lesson and then learning those tools and tricks that they not only put into their leadership but in the rest of their life, I think it made a big difference. And you could tell when they kind of reached that point in their journey. I
agree. And I think that the positive thing for these folks is they tend to be very, very prepared for their particular plan, right? The challenge is when their particular plan starts to fall apart, right? That's where they tend to be, right? They're prepared for plan A, but plan B, C, and D, when blood fills the field, when your reduction of the fracture doesn't hold the way it's supposed to.
The only instrument that you need, there's only one of them, has just fallen on the floor.
Correct.
Yeah.
Right.
And there's no backup because it's over in the other hospital right now.
Right. The pleaser will figure it out. They'll take, a sterilized fork from the from the cafeteria and figure it out. But whereas the flustered will lose it for an extended period, maybe even the flustered and the tyrant would be ones who would say, well, fine, we'll stand here and wait until you get me something sterile from, across town or whatever.
Right.
And so I think that, but those guys, they tend to be very well prepared for their plan. They tend to be, I also think they tend to be very highly skilled in the moment when things are going the way they need to go.
Tend to be efficient.
Right. When things are going well, nobody has any issue with them. It's when they start to derail or they start to feel things derailing and you start yelling, right? You start yelling and everybody stops.
Yeah.
Right? Whereas if you just take one breath and you start talking with a much more controlled tone, all of a sudden everybody moves in, right? Everybody is like, wait a second, right? You tell if somebody turns and says, hey, turn down the music, right? Not screams it, but says turn down the music. Everybody's like, wait a second.
Yeah.
Something's not right. What's going on here?
If you're the person who's working with the flustered type, identifying that that's who you're working with, at least for my position, I've definitely been around this. And I remember one time it was very much happening, right? The jig we were using that couldn't get the pin to go across it. It's not working. It's not working. There's something wrong with this. This piece of equipment is crap, blah, 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 blah. And I'm just looking at their hand, right? They were bowing the K-wire, right?
Right.
And so just literally being in a very calm tone and instead of retracting away, which is what you want to do when you're with that person, going up to him and saying, drop your hand. And seeing that happen and then
and then everything's fine.
Yeah. So unfortunately, if you're around that person, if you can keep yourself calm, and now two flustered people together, that does not work out very well.
Does not get you where you need to be. Correct. That's where people start calling other people into the room, where the complete loss of control is happening, and those are tough moments.
Yeah, but again, as soon as that part went the way that they efficient from there on out, right? Like everything else is just smooth. Right.
And I think between the flustered and the pleaser are both of those two to me seem to be some of the most easily corrected if you can kind of trigger that moment, right? Like for the pleaser, here's how we could get better and identify that you need to say it, but that you're about to not do it. right? You've got to be able to make that click. The same thing when you feel like things are, if you get flustered and you feel like things are losing control, being able to identify those moments and then make that change. I think, I think those tend to be very tangible moments that you can look at and say, here it is. We're at the end of the case. What could we have done better? I'm choosing not to say anything, even though there were 5 things we could have done better, right? If you're the pleaser and you can identify that, or if you're flustered and you're in the middle, like, and this solution is the same for them, right? I'm starting to lose control. Take a deep breath. Settle down a little bit. Take a deep breath, right? Yeah. And then move forward. So I think that that's a lot of. I mean, there are a lot of surgeons who get flustered. I'm sure there are a lot of leaders who get flustered, who lose it. A lot of parents who in moments, right? You instead of having a calm moment, right? And what happens when you lose control in that parenting moment? Kids shut down, right?
And if you're a flustered pleaser, oh my goodness, right? It's even worse, right? Because I want to make everybody in my household happy, right? I want everybody to have everything that they need. I want everything to go well. But oh my gosh, I've been asked for 80 things since I've been home. And also, why am I not the fun mom who still has the Easter eggs out right now so we can have another Easter egg hunt for the 80th time since Easter?
Right.
And realizing that, like, okay, you're just getting a little bit. It's a little too much. We just need to take a step back, take a deep breath. We're going to outsource a little bit of responsibility to somebody else for just a moment so that we can get ourselves composed, realize what we're doing, and then regroup.
Move forward. Yeah.
Yeah. And again, be decisive. Hey, I know y'all liked Easter egg hunting. That was super fun. We had a great time doing that. Mom's already put the Easter eggs away. Like, we're not going to do that anymore.
Right.
How about instead we go play some Monopoly, or we're gonna play some Uno, or something else that's fun.
Pictures. Yes.
Yeah. Or how about, which is what I ended up doing. They really liked the idea of the golden egg, but we wrap our golden eggs in foil.
Nice. So they're silver.
We're real classy where I grew up. We didn't have golden eggs. We just wrapped a regular egg in foil.
Nice. I like it.
So I made a foil egg, and I just hid that for a while around the house, and they would all go looking for it.
Go find the foil egg. I like it.
Anyhow.
Aluminum.
There
you go. That's what we were looking for. Let's see. What's the next one? Oh, unprepared or underprepared.
Ding, ding, ding.
So that's a tough one, right? Because that carries with it some pretty substantial, like, how do you lead if you're not prepared sort of idea.
Yep.
And so, but we see that happen, right? We see that happen where people go into the operating room trying something new, or they're about to get they're in a case that they haven't done in a long time. And so now it's, hey, what's the next step? Hey, what do I need to do here? Hey, how do I prep this graft? Right?
Yep.
Right? Where am I supposed to do this? Why is this thing not working? And then they tend to, the pathology is they tend, even though they came in underprepared or unprepared, they blame everybody else for the issue. And that tends to be where people move. So how on earth could we find something positive for the unprepared?
They do tend to be very teachable.
Yes. Teachable is good.
They're very receptive to hearing how to do stuff. They don't know it all. That's a good thing. Like they tend to be open to suggestion, idea. They tend to be team approached, right?
Right.
They don't see it as I do everything on my own. They're not like the pleaser who's going to get it all taken care of all by themselves, even if it's just them and a matchstick making things happen.
Sure.
Or a sterile fork.
True. Looking around the room, and the PA agreed, and the anesthesia assistant agreed.
Yeah, that's one of my favorites.
Like we're just going through and we're gonna
looks at me and I'm like, I've just been here for 3 days. This is me on my first clinical rotation. Okay, the PA student agreed.
Right. What do you think about this? So yeah, I mean, I think that there's certainly a bit of courage in doing things that you haven't done before, right? And so, or maybe that you haven't done.
Kind of confident to walk into somewhere like that too, and just say, I know I can do it. I have faith in me.
Right. And then, but I think also there's a piece of that where you have to be able to recognize, like, hey, the last time I did an ACL was 2021, and here I am going in, right? Have you prepped the way? Obviously, we do a lot of ACLs, but if somebody's not an ACL person, or it's like, hey, I'm going to go do this, I'm going to go do a reverse total shoulder arthroplasty, and I haven't done one since I was a resident, right? Or something crazy like that, right? All of a sudden, when things aren't going right, that ain't on the team that's in the room.
Right.
That's on you for not being prepared to do what you need to do.
Yep.
But I do think that there's right. So you do have a little bit of not only confidence, but courage, right? I mean, to go out and do something that maybe you and it may be a little bit misplaced to some extent, confidence.
Right.
But to that point, they tend
That's
to be
something you can work with,
confident,
right? Blind confidence, not always the best.
Right. No question. But I think that there's something there. I think there's something to be said for that. But I think that people know it. Like I think that the person who comes in under or unprepared, that oftentimes doesn't recognize that they're going to be unprepared. Right? When they get into the moment and it's like, oh man, there's 150 steps to this. And in my mind, I remembered the first 5, but what's coming next? Right? What's next? How does this instrument work? What is, all of a sudden you're now in the process. And so you've got to figure that out obviously before you get there. And if you have that tendency to be in the room asking the rep or asking your team like, hey, what should we do next?
And then what happens?
Right. How would people normally do this?
Yeah.
And so I think that certainly those folks are teachable.
Willing to learn some
also in
new
those
things,
moments, you've got to be able to, it takes a lot of self-reflection to say like, hey, I posted this case and here was right. And now I'm going in and I didn't have enough insight to realize it's been, whatever, 10 years since I fixed a clavicle or whatever it is. And it's like, well, that's going to make this into a much more challenging scenario that's going to put a lot of pressure on the rest of your team and on the people in the room.
Well, and I think if you realize that you're that type, again, if you are, they tend to not be like so self-centered and they're confident, but going, okay, well, maybe for me, I need to make sure that in my work day or in my time, I have it blocked out, that I have this time to reflect and to prepare, to make sure that I don't walk into something unprepared anymore.
Right.
But that's essentially knowing how to schedule and block time. It's
right. Very good. That's not an easy one.
Eh.
But I think that to say that you've been in that scenario, like for any leader, to at least if you really reflect and you say, have I been underprepared before? I think that's definitely something. If you're honest with yourself, like there are those moments where you're like, ooh, I got into that. I got into something that I maybe wasn't ready for it as much as I thought I was. Right?
Sure.
I mean, when you get into your first pec tendon repair or you're going in and you're repairing a proximal hamstring, right? Something that you do once or twice a year, maybe.
Proximal hamstring means that we're making an incision in somebody's gluteal crease.
Right.
Right there.
The horizontal crease, to be specific.
Right where you're thinking.
No, maybe not. You're assuming everyone is thinking the same crease. I'm thinking of
the butt cheek.
Right. The bottom portion
of the butt cheek.
Correct. But you're working in high risk territory with anatomy that you haven't seen.
Nobody's
seen regularly, right? It just is not a common surgery. It's not a common surgery. And
you go into a surgeon's office, you're like, how many proximal hamstring tendon repairs have you done in the last,
And they tell you, I've done 500. It's like,
turn around and just walk right on out. Because that means either they're diagnosing everybody with them, and because they just really like digging in butt cheeks, and they want to make a name for themselves for that.
The podcast.
Butt cheek.
Try not to do that. Digging in butt cheeks.
Yeah, they're over-diagnosing, right? Or they're lying.
Right.
Yeah.
All right. Well, that was good. That took a turn I wasn't expecting, but
to the butt cheek.
Correct. The flustered. You son of a... All right. Lastly is the distracted. Also guilty of this. Probably my secondary pathology.
Your secondary you think's distracted?
I would say distracted, pleaser than distracted. What do you think? I mean, I've taken the test, so it's not that fair.
You kind of also wrote the test. So.
Correct. But I wrote the test. In all honesty, I wrote the test thinking none of these are me, which is kind of tyrannical. If you think of it that way, you're like, then I took the test and I was like, what happened?
This is weird. It doesn't say I'm perfect.
It doesn't say, this doesn't say that I'm the best. What?
I wake up every day and I tell myself that guy's going to have a great day.
That is true. That is very, very true. I usually feel quite good. Most all the time, I feel pretty
Especially
good.
when somebody tells you that you look like you have a big head and going bald.
Look, you have a big head going bald. And
Nice
it'd be
smile.
fun to have a nice smile. That's positive.
Yeah, nice smile.
Big head, big brain.
All you heard was I have a nice smile and I look like somebody would want to have a beer with.
Right. And they said going bald. So that
went
implies
bald.
we're not there yet. So, yes.
Yeah.
This is good news.
Okay. Anyway,
All right,
we were talking about the distracted.
lastly,
We got
the
distracted.
We got distracted.
While talking about the distracted. Okay, yeah, it's
So-
definitely your secondary pathology. I'm there.
Correct. So
I might contribute.
The distracted, two distracted people. Dang it. So the distracted tends to be somebody who struggles a little bit with finding that priority,
Mm-hmm.
right? So everything is a high priority, and when everything's a high priority, nothing is a high priority, right? So they tend to be the one who will go build the chair for the office, or they'll go and do the things, and sometimes they convince themselves, hey, there's nothing below me to do. But the reality is they use those levels of distraction, whether it's a scheduling patients or scheduling something or answering their text messages or their emails or being distracted by their phone, right? It actually is a bit of a defense mechanism from making the high level strategic decisions that they need to make as a leader.
Right. But so the positive thing I would say about that person,
Right.
besides just being driven, but also, there was a quote that stood out with me and I was trying to remember it, was that opportunity is often missed by people because it looks like hard work and is wearing overalls.
Right.
Right. And the reason that makes me think a little bit about the distracted person who's so busy, like just finding things to do. I'm going to go draw up the injections rather than make this high level decision or whatever, is sometimes in doing those tasks, you can see things from a different perspective if you're a leader. That make you change things, right? Like simple tests like, well, why are we, when I'm drawing up this injection using this 18 gauge, there's a little piece of silicone that's coming into this. We shouldn't be doing that. Why don't we switch to using 22s? And then that's more of a, that's a little, it's not super high level, but it's higher level, right? And in doing that, making that a policy that goes across so that your patients have better care. That's an example of how sometimes a distracted person can end up where they need to, helping to make some decisions that they need to.
Sure.
So they tend to be driven, and they sometimes can see things from a different perspective by doing that more kind of tactile, low level, not high level work that sometimes allows them to open up to those. But it's looking for that, right? It's looking for those opportunities.
And I think there's a balance, right? I think there's a balance. And I think any good business would tell you, like, right, if you want to learn how the business works, you need to go spend a day. You need to go spend a couple of hours, right? If you want to figure out, like, hey, why is this the last instrument that we have in the building? Well, if you have never been to sterile processing and seen what they do in sterile processing and how they do it, yes, unreasonable hospitality.
Bussing his tables and doing all that, the low level stuff, right?
But he didn't bust his tables always. Right. He went down and he went, I shouldn't say down, but he went and did those things so that he never lost sight of where it was, but that was very intentional in the moment. And I think if you're doing it intentionally with that idea, how can we improve this process? How could I see, what am I missing from the sky level, the mile high view versus the being in the weeds type of view? If that's your approach, then that can be very, very positive. If you're letting it become, hey, I'm going to answer every single text message that I get all day today. I'm going to make sure that everything, right? I'm going to make sure that I do this, and that my team knows that it's not below me to take out the trash, and it's not below me to drop injections. It's not below me to do this. Then all of a sudden that actually becomes a defense mechanism, because now you've taken up your whole day. You felt like you've had a very busy and productive day, but what you needed to do was make the high level decisions. You needed to set out the strategy for your team to be successful in the future, and allow those different those other projects to be delegated to folks who probably not only do them better, enjoy doing them, and can free you up to make the big decisions you need to make.
Well, and I think that again, one of the tools to help that person is giving yourself timelines and deadlines, right?
Right.
Like, okay, like I don't have a concrete solution to this problem that I need a solution for, So I'm going to give myself this amount of time to like do this.
Right.
Again, because some people, that's how they come up with ideas, creative solutions
Right.
For things, is to do that more tactile, like lower level work. But again, can't be indefinite, can't be always, can't be forever.
Right.
And saying, I'm going to do something productive, though low on the decision making here, to free up my brain to do some of that processing. And there's a lot of literature out there to support, having hobbies or crafts or things like that, where you don't have to, all the synapses don't necessarily have to fire at that level, but both sides of your brain are working together, right? Your hands and your mind.
I agree. And so I think that level of dedication to the team, that high level team member and that teamwork is definitely a positive for that person who's distracted. But I do think that distraction in and of itself can be an absolute time suck from your goals, right? To get you where you need to be, right? That author or business person who's like, man, I've got a deadline and my house has never been cleaner, right? Right. I don't have one single dirty sock in this whole house because I did all my laundry and I prioritized doing the laundry over, taking care of this business that I needed to get taken care of.
Oh,
right.
Yes.
Whether it's doing your taxes or writing a book or planning, your entrepreneurial,
Studying for organic chemistry in college.
Right.
My baseboards were never cleaner.
Right. Studying for organic. Yep. It's like, man, the dishes are looking so good. I better make sure that last fork I used is still clean enough.
Which again, then one of the solutions to that problem for me was that I had to leave my house, right? I had to go and sit in the library because, okay, now this is where I study,
Right. I agree.
It's that process.
Yeah. I agree with that. I think it's good. That's a lot of leadership today.
So much leadership.
Yeah.
When is AI going to take over my job?
I don't know. I think you're irreplaceable, Taylor.
Are you sure? Have we tried really hard, though?
That was a compliment.
I thank you.
You're welcome. The hard part, I will talk a little bit about AI. I think it is insane how much people are craving interpersonal interactions, right? Like the real human thing, right? Where you're together with a person, right? People could generate this podcast via AI, I'm sure. But it wouldn't be nearly as fun.
Yeah, that guy wouldn't be going bald and have a big head, but a nice smile.
It'd smell like cheese. It didn't actually technically say that.
You smell like beef and cheese. You don't even smell like Santa.
I don't even smell like Santa. But, well, very good. I don't know that we've talked about all the leadership stuff. We already know your favorite pie is rhubarb.
Strawberry rhubarb.
Please
do not bring me a plain rhubarb pie ever without the fruit.
I don't even know what rhubarb.
That would be like us bringing me a celery pie.
I brought you this pie made of sawdust and sadness.
Here's an ants on a log, but it's just the celery. There's no peanut butter
or raisins.
Yeah.
Or chocolate chips.
I was gonna say chocolate chips is the superior way to go on that, and you just scrape that out and don't eat the celery.
Throw the celery away.
It's just the vector. It's like a spoon. Really, just use a spoon.
Right. Very good. All right. Well, I think that rocks, man. We're good. That was what we needed for the day. We've already done content today. We've done podcast today. Clinic today. I mean, it's basically like a party.
Didn't get my workout in, though. So sad.
You can go now.
I can't. I gotta go get my kids. They exist still. It's my responsibility on this time of day to go get them.
It sounds like you're distracted.
No, my spouse gets to work out right now. This is his time. If I take it, then he doesn't get to. That's not fair.
Something kind of flustered.
I'm going to throw a shoe at you. With all due respect.
With all due respect. Yes, I love it.